Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop or relieve your neck arthritis pain at home. But before I do that, I'm gonna go over the symptoms, the causes, the risk factors, and the steps you can take at home to relieve your neck pain. So what are the symptoms of neck arthritis pain? So you might experience some stiffness, tightness in the neck. And if for severe cases, if you have severe spasm, you might experience some tension headache. Also, if you have severe arthritic changes in your vertebrae that compressing on the nerve, you might experiencing numbness and tingling in your hand, your arm, your elbow. So what are the causes and risk factor for neck arthritis pain? Well, you might have it from osteoarthritis or rheumatoid arthritis, which is degeneration in the joint itself. And you can see it here in this image. Your spine should look like nice and smooth here. And when you have arthritic change like osteoarthritis, you have uneven surfaces that could compress on your disc, that causing herniated disc. The other risk factor that's commonly causing the issue is poor posture, poor body mechanic. If you're slouching forward for a very long time in front of the computer or TV, or while you're reading or using your phone, that is actually going to cause arthritic change in your neck. And also, if you're driving for prolonged time with slouching forward, that's a risk factor for actually having arthritis in your neck. The other risk factors are whiplash, like if you had any accident, trauma, or you fall down, or motor vehicle accidents that cause a strain or sprain to your muscle and ligament, or herniated disc, or you had the spinal stenosis, narrowing in the spine, the canal, and also if you have kyphosis, or that's a leaning forward or hunching forward. I have videos on most of these causes in my YouTube channel. Feel free to check it out. The other cause could be facet joint syndrome. So you can see in this image, the lower image here, that's when you have your disc is nice and normal here. By the way, if you are 50 years and older or 40 years and older, most of us has herniated disc. That doesn't mean your symptoms from herniated disc. So you can see in the lower image here, that's a nice and smooth disc here, and when you start to have herniated disc or degeneration, it's compressed on a nerve, and most of this patient might experience some numbness and tingling, and you can see it from the side view here. So neck arthritis usually happen here. This is a skull, and it's happened around this area in the neck. But I'm gonna show you the herniation on the bottom here because that's what I have in this model. So normally the disc should be nice and smooth. There's nothing sticking out. And then when you start experiencing herniated disc, you will see that redness here that will be sticking out, compressing on the nerve and cause numbness and tingling, and that's the same thing happen in here if you start to have experiencing numbness and tingling in your hands and your arm. The other thing I mentioned is you might experience some headache, and especially tension headache or migraine. If you have a lot of arthritic changes here and a lot of tightness, you see that red part, that's the vertebral artery that supplies the brain with the blood flow. So when you have a lot of tightness and a lot of restriction here, that could compress on the vertebral artery and decrease the blood flow to the brain and cause migraines or tension headache. And I have videos on each of these conditions in my YouTube channel. So as I mentioned, one of the common issue that causing neck arthritis pain is poor posture. So normally when you look at the first image here, when your neck in neutral position like this, 0 degrees, your head weigh 10 to 12 pounds. When you start to slouch forward in the front of a computer, TV, or your phone, and your neck will start to weigh like 60 pounds. That's a lot of weight. Your muscle here not built to lift that heavy weight. So if you do that for 2 hours, 3 hours, or 5 hours a day, it's like you are in the gym doing a biceps curl for 3 hours. So you're gonna strain your neck muscles, you're gonna cause degeneration in the joint, and you can cause micro tear. And I want you to try now with your hand, try to push on your trap muscle. If you start to feel a knot or a bump or a ball in here, that's high chance is a scar tissue related to poor posture, poor body mechanic, or if you had accident. Why this is an issue? Because that's gonna cause muscle spasm, and it's actually gonna cause more rubbing on your vertebrae. That's gonna cause more arthritic changes. So how to treat the root cause of neck arthritis pain? In order to answer this question, we need to understand the normal healing cycle so the treatment will make sense how to get to the root cause of the problem. I'm gonna use external paper cut here for visualization, but the same process happened internally from poor posture, poor body mechanic, arthritis. So the first stage of healing is called inflammation, and you can see it here in the first image, swelling, redness, the blood starts to rush to that area and you start experiencing pain and decreased range of motion. The second stage of healing is a proliferation stage. That's when your body starts to build the scar tissue, fascia restrictions, muscle spasm, and trigger point. Perfect scenario actually during the maturation stage. You can see in the last image here, your body starts to get rid of the scar tissue, fascia restriction, everything, including the inflammation. If our body does not build the scar tissue, your cut will be open wound susceptible for infection. So scar tissue, very essential for our survival. So when you have arthritis in your neck, anything ending with itis is considered inflammation. So if you have osteoarthritis, neck arthritis, rheumatoid arthritis, these are inflammation. And if you have it for a very long time, there's a high chance your body going back and forth between the inflammation stage and the proliferation stage. So why this is important and why that's significant? Because when you look at your muscles, your normal muscles should look like nice and smooth like here. And when you have a strain or tear from poor posture, poor body mechanic, or internal tear, the tear will happen randomly like this. So your body has to build the scar tissue randomly to heal. The problem is when you have too much of that adhesion, scar tissue, that in the way of the muscle contraction, because our muscle should act like a rubber band when you contract and relax and stretch like this. So when you have a scar tissue, it's like you have a knot in the rubber band. When your muscle contract, will not stretch much, and that cause decreased range of motion and tightness and lead to pain. And when we look at the other issue, if you have like herniated disc, that's inflammation here in the disc. When you have arthritis, that's an inflammation, arthritic changes. So there is inflammation with the neck arthritis pain, and there is a lot of scar tissue, fascia restriction, and muscle spasm involved at the same time. So how to get to the root cause of the problem? Before I go over the tips that you can use it at home, I'm gonna go over common treatment that doesn't work based on the studies, and when we relate that to the normal healing cycle, it will make a lot of sense why this treatment doesn't work, so you don't have to waste your time on it. One of the common things that use ice, steam, and heat, and when you start to look at the normal healing cycle, it's not going to break the scar tissue, it's not going to release the fascia restrictions, it's not going to do much for the inflammation, and the study shows it provides temporary pain relief if you're lucky for half an hour. The other thing that's commonly used, massage and foam roller, and based on the study, it either provides short-term pain reduction or no pain reduction. But when we start to look at the normal healing cycle here, if you have inflammation and you keep rubbing inflamed area or tear, you're gonna inflame it more. And when I go over the fascia system and the scar tissue, it will make a lot of sense why massage and foam roller are not effective. The other thing that's commonly used is stretching, and I personally do not recommend stretching to my patient because based on the studies, it provides temporary pain relief or no pain relief, but the problem, if you overstretch, you could cause more damage. Why? If you have a micro tear or a tear in the muscle or an inflamed muscle, and you start to stretch, you're gonna tear it more. And actually study shows it causes more inflammation. So there's other alternative safe option than stretching that we'll go over in this video. The other thing that commonly used by healthcare providers like chiropractor, occupational therapists, physical therapists, is the joint mobilization or manipulation or adjustment. But when we look at the issue that we have issue with inflammation and proliferation. Moving the joint will not break the scar tissue, release the fascia restriction, will not decrease the inflammation. Actually, if you overdo it on the arthritic area, you're gonna cause more inflammation, and especially if you have instability of your neck from inflammation, that will be a risk factor to having more symptoms. And it's actually studies showed that joint mobilization, it's either provide temporary pain relief or no pain relief. The other thing that's commonly used is strengthening exercises. The problem with that is if you strengthen your muscle while you are in inflammation stage, you're gonna inflame it more. The other thing is there's other effective exercise like core stabilization, posture training, function training that's much more effective than strengthening exercises to strengthen your muscle and correct your posture. So how to treat the root cause of the problem? We have to be aggressive on decreasing the inflammation because neck arthritis is inflammation, and we have to break the adhesion that caused from the proliferation stage. So what I personally do is avoid the motion that aggravated, avoid prolonged driving, prolonged slouching forward. You need to open up, you need to really start to move your neck around. And at the same time, we have to be aggressive to decrease the inflammation in your neck. So what I personally do is I use a MagnaHeal 2. This is a very strong magnetic device that the magnetic field around 3 inches. So can be used on the neck to decrease internal inflammation if you have the inflammation from arthritic changes in the joint, or you have like herniated disc or something like that. That's a very good option to decrease the internal inflammation. At the same time, I like to put all my patients on anti-inflammatory diet because we know there's certain food that cause internal inflammation. Want to make sure to eliminate that food so the body move smoothly from inflammation proliferation to maturation stage. And for severe rheumatoid arthritis cases, or if you are diabetic or have high cholesterol or blood pressure issue, that is a sign of you might have vitamins mineral deficiency that slows down your normal healing. One of the things that you can do right now is actually take advantage of Ask ASTR. It's a free online medical evaluation. The software will help you and guide you to figure out what possible vitamins and mineral deficiency you might have. And it usually takes about 5 minutes to answer the questionnaires. So while we're working on the inflammation, decreasing the inflammation, we have to break the adhesion of the scar tissue, fascia restriction, and muscle spasm. So what I personally do is I use the A3 to break the superficial scar tissue, and then I use the A5 to release deep fascia restriction, trigger point, and break deep scar tissue. That's why I said the foam roller and massage are not effective, because it's mechanically impossible with the foam roller, with the hand or the knuckle, to go deep enough to release deep adhesion. It's impossible, especially in the trap here. You cannot go deep enough, but with the A5 you can go deep enough, 2.5 to 3 inches. And if you cannot apply mechanical force on the adhesion side, you will not be able to release it. Think about this way: if you have a screw you want to unscrew in your motor, and the screwdriver you have is very short, it's impossible to unscrew it. That's the same thing happen internally in the body. If you cannot apply mechanical force in the muscle, in the adhesion site, you will not be able to release it. So that's why we cannot, the massage and foam roller will not be effective to release it. One of the other things that commonly overlooked for neck arthritis pain is the fascia system. Briefly, I'm going to go over the fascia system here because I want you to appreciate the complexity of the system and the importance of addressing the fascia system to really get to the root cause of the neck arthritis pain. So the fascia system, you can see here the white tissue here, white filament, is the fascia layer. And when you go next time and buy meat, notice that there is a white filament here, and that's actually the fascia system. So the fascia system consists of two major layers: the superficial layer and the deep layer. a superficial layer wrapping the entire body, and the deep layer is divided to 4 subcategories. To make things complicated, um, each of these layers have 2 to 3 layers on the top of each other, but don't worry, the treatment is very simple. So the deep layer, the apparatic fascia wrapping a group of muscles, and then we have the epimysin wrapping each individual muscle fiber, and then we have the premiysin wrapping a group of muscle bundles, and each individual muscle fiber is actually wrapped with the endomysin. So when you do release, you cannot pick and choose, oh, I'm gonna release the superficial layer because I cannot go deep, because the foam roller or the massage will not go deep. But it's impossible to get a good result of picking and choose which layer to release. We have to release all these layers, because when you have all this tightness, it causes your posture to go down. It's actually shifting your vertebra and causing more wear and tear on your joint. So we need to release everything and then really correcting the posture. So what I personally use is the A1 to release the superficial fascia layer and apparatic fascia layer, and then I use the A5 to release the epimysin, premiysin, and endomysin, and that's really can go very deep in the trap area to release it. So to sum it up, for neck arthritis, we have to be aggressive to break the vicious cycle of inflammation and proliferation. Simultaneously, while we decreasing the inflammation, releasing the adhesion, the scar tissue, the fascial restrictions, we have to do core stabilization, correcting your posture, because that's one of the cause and risk factor for having arthritic changes in your neck. So that's conclude our video for how to treat neck arthritis pain. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.